Right, let's admit everybody. Mm-mm-mm. Exciting.
Yeah.
I'll just wait for more people to come through. Lovely stuff. If everyone wants to put in the chat where they're from, that would be really cool to see. Because I know that Annie's from down under. Sorry, that was an
That
awful accent.
was terrible.
Um, but yeah, we might have people all over the world today seeing us. How exciting is that?
That's
I
really
find it
nice.
mad still that we can actually do that. Like I'm talking to you from like the UK and you're
Yeah.
all
When
that far
you
away.
when you messaged me, I was like, oh, how am I going to work the timing out? Like, it's going to be really challenging, but
It's not too bad though, is it?
we did it. Yeah, we've done it. It's 6 p.m.
Yeah,
It's not too
it's not too bad, yeah. Because here it's like well, it's early for me.
bad.
Um, so I do appreciate everybody that's on. Oh, let's have a look, see where everyone's from. And then we'll get into it. Got Western Australia, got Inverness in the Highlands, got Leicester, oh, you're around the corner from me. Highlands of Scotland, welcome, welcome. Got Ireland, England, Norfolk, Southampton, Suffolk, Australia. More from Australia, Annie. Hampshire, Bristol. Oh, amazing. Lovely. I'll just wait a little bit longer to make sure everybody is in. Got 25 people so far. That's not too bad, is it?
Full.
Because I know that we had a lot of sign-ups, and that's why I said this morning on Instagram, like first come, first serve sort of thing.
Yeah.
So get in, but yeah, I'll just give it another a minute or so and then we'll
No
crack
worries.
on. But if you haven't popped where you are from in the world, we would love to know. Mm-mm-mm. I think everyone can hear me okay as well and hear Annie okay. I can definitely hear Annie okay.
I can hear you okay. So let's hope everyone else can.
Beautiful. West London, New Zealand, got Bristol. Oh, got a wide selection, haven't we, across the
Yeah.
world today? Wow, lovely. Right. I think then we can crack on if that's all right with you, Annie.
Yeah, let's do it.
Let's have a look. So, before we start, everybody, I just wanted to do a little housekeeping. So if you can keep yourself on mute, that would be absolutely fabulous. Unless you want to say anything, use the raise hand button and we will get round to you. Or if you've got any questions, just pop them in the chat. I am actively looking at the chat as well, whilst Annie has her little talk about things. So, um, yeah, just drop anything in the chat and we'll get round to it as soon as we can. You can keep your cameras on, keep them off, whatever you want to do. I mean, it's absolutely boiling in the UK, so I've not got any makeup on. My hair's gone wild. So if you do want it on, absolutely you can put it on. There's no there's no judgment over here. As well, this is a nice, safe and supportive space for everybody. And this call is a part of the Positive Vet Nurse Club as well. So we will have our members in the call as well watching. So yeah, I think that is all on my end. Um, so what I'm going to do is stop sharing my screen for a second. Sorry, my laptop's been a bit slow. There we go. Okie dokie. So, welcome to the Overcoming Anaesthesia Anxiety call. So, I know that a lot of people struggle with this like massively. I used to be one of them, Annie used to be one of them as well. And today's just a really nice interactive session. We'll be doing it for about sort of an hour roughly. But if we do go over, and you need to go, that's absolutely fine. Don't worry, we're not offended. Um, So yeah, today's going to be quite a nice call. It, like I said, it's interactive. We're just going to be having a bit of a chat. Again, if there's questions, we'll answer your questions, but hopefully we can cover everything, and make you feel a bit better about anesthesia by the end of it. So yeah, Annie, would you like to do a little
I'd
introduction
love
of
to.
yourself and
Yeah, for
your
sure.
journey? I think
Yeah,
that would be amazing.
for sure. So, I graduated from VetTech in 2018. I did randomly a little equine science degree in there as well because I thought, that's what I wanted to do. I started working in like a primary care practice straight out of uni, and it sort of, I guess, brings me to like one of my first points, and one of them, I think, most important parts of like building confidence is, I started in a small clinic, and the previous head nurses left. So all of a sudden, I became like the most senior nurse. And that was quite daunting. I'd been out of uni for what, like 6 months, and all of a sudden, I was in charge. And I didn't have a mentor. And I think that is one of the most important things. And something I would always recommend is that you sort of start off with a mentor. So I didn't have that. I started to really love anesthesia. I sort of worked in this clinic for like a year and a half. And then, I realized that I wanted to transition to a surgical nursing position. And one popped up at the clinic I work at now, which is Queensland Veterinary Specialist in Australia. And I loved the work, I really did, but this was sort of the first hurdle in, my confidence is I transitioned from a primary care vet where I wasn't, placing IVs, I wasn't intubating, I was monitoring anesthesia, but very basically, I had a pulse ox and I had a Doppler, and I sort of learned how to use these really well because it was, all I had access to. But I stepped into like this specialist clinic, and all of a sudden, like things were very different than what I had previously experienced. And this was sort of the really big first dip in my confidence as a nurse and in anesthesia in general. I guess like skipping forward, I now am a VTS in anesthesia, which was, a solid 3 years. I qualified last year, so I now am a VTS. Anesthesia is, my favorite thing in the whole wide world. And I'm like now the surgical anesthesia team lead at QVS. And, I train a lot of trainee techs, tech interns, and new nurses. So, I've seen anesthesia anxiety in every way, shape, or form. Um, and I sort of think, like, I think the number one thing for me, and something I'm going to talk about a lot, is having a mentor. And I think that's probably one of the most important things. Um, I guess like continue on with my journey. I think like in anyone's career and in anyone's journey, you're going to have peaks and troughs in your confidence. So, I speak about that first dip in my confidence was, stepping into the specialist clinic, and I really didn't know what I was doing. I hadn't intubated a dog before, I hadn't placed an IV, and all of a sudden I've stepped into this world where nurses pretty much do everything. So my confidence hit rock bottom. At that point, I didn't have a mentor. This, like a senior nurse was there, but she was sort of at the end of her nursing career. She'd kind of tapped out a little bit. So I was kind of thrust into this environment, and I was uncomfortable a lot of the time. I used to go and hide up at the autoclave because I thought it would make a difference in me, like doing an anesthetic. So I would hide up at the autoclave so I didn't have to do an anesthetic, which, probably didn't affect whether I got put on a case or not. But to me, I felt like I was, hiding. Um, and then the first sort of started in the first step towards, confidence for me was we got an anaesthetist. And he was, my first mentor. He was really epic. He was this really chill guy. He came into QVS and he started working 2 days a week. So I really started to like to build my really solid foundation skills. And, that's like monitoring. I was getting good at making anesthetic plans for our, ASA 1 to 2 sort of cases. And at this point, I was starting to feel a little bit more confident in my skills and in my anesthesia in general. So then, I started to progress to some more challenging cases. And then this was the second step where my confidence took a plummet. And when the anxiety sort of started up again was when I was, starting to be put on these more challenging cases. And, I actually really had no idea again what I was doing. Um, when you start getting put on more challenging cases, like the things you're thinking about are completely different. How you're managing complications is completely different. So again, like my confidence took a plummet. Um, I guess for me, like I'm quite a practical person. So what really started to change it up for me was if I didn't know something, I would go and learn it. So if I knew I was being put on a challenging case the next day, so like for example, I don't know, like a dog with a heart murmur or a dog with like an adrenal mass or whatever, I would go and study it. And this was an important part for me, and this is how I started to really gain my confidence, is that I would go and study it. I would go and learn it. So the next day I would get to my case and I'd be like, oh, I actually did just research this. So I have an idea. Or, I'm using this drug because it doesn't affect the heart in this way, or, et cetera, et cetera. So this would be my sort of next bit of advice for anybody that's, not feeling so confident in particular areas is do your own research and do your own study. It really helps overall with your knowledge, and it's going to help with your anxiety the next day. You've already sat down, you've looked at the dog, you've looked at its comorbidities, you've looked at its bloods, you have some time to process, what you're going to be doing. So, you know, go back to a textbook, and I have a ton of really good resources on my Instagram. I have a good set of anesthesia textbooks that I use religiously. They're not all super complicated. One of them really like breaks it down, how to anesthetize these patients, and that was started to be the game changer for me. So I really started. Yes, we'll absolutely send through the Instagram. We'll do that at the end, I think. I have a lot of really great resources, and this was the first really good step for me was, learning these comorbidities, learning these, little intricacies that start to affect your anesthesia. And I guess this is sort of how I've become like got into the place that I am today, is that I have studied hard, and if I never understood anything, I studied it. I feel like I'm quite a practical person, and I know not everyone is like me and is not practical, or like can't go and just rote learn something. But for me, this was, the most important part in my, my development as an anesthesia tech. Um, so I think that probably sums up my journey in a lot of words. But I think, yeah, studying, was, the most important part for me in improving my confidence.
Amazing stuff. I love to hear about people's journeys, especially when it's one where, you used to feel, bad about something, you used to fear
Yeah,
something. I love to
100%.
see people turn it around
Yeah,
and do amazing things in their career. I find it really, really inspiring. And I know how hard these things are, to want to give up with stuff and
yeah,
you think, oh, should I be a vet nurse, a vet tech, or,
yeah,
maybe this isn't the job for me. And you go through all those
yeah,
things in your mind. But like you were saying, there are ways to overcome things, and we will go into more detail as well. But for you, Annie, where do you think your anxiety of anesthesia came from? Like, what do you think was the thing that you kept repeating in your head? Because often it is just one little niggle and then it
yeah,
turns into this massive,
yeah,
ah,
yeah.
crazy
I think
thing.
like when I first started, it was I'm in a theater by myself. There's a giant surgeon doing, a big gruff surgeon doing this surgery. He's, yelling-ish at me to be like, keep this dog asleep, Annie. Like, what's going on? Like, get me this instrument, get me that instrument. And I'm like, oh my God, like I'm trying, like I'm just one person. Like, I think that was definitely a big part of my anxiety at the beginning was I was having to focus on too many things. I think the not knowing was probably the hardest part, and what gave me the most anxiety was, I don't know what to do if this patient is hypotensive. I don't know what to do if this patient is painful. I like don't know what my next steps are. And I think that was just because like I didn't have someone there to be like, okay, Annie, like if this dog is hypotensive, this needs to be your next step. Or, if that doesn't work, then we move on to something else. So I think I was thrust into this environment. I didn't have a lot of support. And I like genuinely think like if an anesthetist hadn't started at the time that he started, like my career would look different to what it does now. And it may have led me to leave because, the anxiety just gets too much and you start to doubt, exactly like you said, like, is this for me? So I think like Nick starting the anesthetist really changed my outlook and I've gone from hiding to like anesthesia being my favorite thing in the whole world. Like I am excited to go to work each day because I get to anesthetize patients. And so I think just like one small factor changed my career for the better. But yeah, the not knowing what to do next, because things in anesthesia, they happen so quickly. And it can be such a little change. It can be such a little change that it can be hard to pick up. Um, so yeah, I think the not knowing is probably the hardest bit for me.
No, I get what you mean, and I really resonated then with like, being shouted at in theatre, like, grab
Yeah,
this, grab that. And I remember
yeah,
myself, like, the worst things for me were orthopedic cases.
yeah,
And I think that again, that came from not knowing enough. I didn't
yeah,
really know what they were doing. I still don't really know what they're
yeah,
doing.
exactly. Yeah,
Um,
it's
and
hard.
then when you're in there and, if you're freshly new, which I
Yeah,
was to anesthesia, you're only just qualified, you're only just getting the ropes with what
yeah,
basic anesthesia is. So when you're
100%.
in there, you're getting shouted at,
Yeah,
grab me the thingy, my
yeah,
bob. What's
yeah,
the thingy, my bob? I don't
yeah,
know what you mean. Or the clicky things, you know.
yeah.
If you
The
work
like
with
the gear, the
orthopedics, you'll
surgery
know.
gear was also a really big part of my anxiety because it like I was exactly like you, like I had no
Yeah.
idea what anything was. And when they need it, they need it now. They don't want to wait. So yeah, that definitely added to the whole like OR stress was just like just not knowing what I was doing at all.
Yeah, exactly. And it's hard to stay calm in those
Yeah.
situations.
Yeah. Like you're
Uh,
starting to get
yeah.
heightened and then they're starting to get heightened and then, it's a bit of a fluster.
Do you
Definitely
think?
something I see. Like now I would be like, no, just like wait 1 second. I just need to, like give me a second. But, I've worked with these surgeons now for, like 6 or 7 years. So like they know me, I know them. But as someone who comes into the clinic, they don't they couldn't. So like I totally understand because I was definitely there at one point. Yeah,
Yeah.
it's hard.
I think it's difficult to build that kind of, I don't know the word for it, but to be able to, I guess it's set a boundary almost.
Yeah,
It's to say,
100%.
you know what, look, I'm
Yeah.
not comfortable.
Yeah,
Like, can we slow down a little bit? 'Cause sometimes it does feel like
100%.
go, go, go. And
Yeah.
then when you're not feeling calm in yourself, it feels like it's
Yeah.
going even faster. And then your
Yeah.
mind starts to feel what I like to call it is like kind of that foggy,
Yeah.
but you've got a bit of adrenaline mixed into it. And then
100%.
that is
Yeah.
never good if you're trying to
Yeah.
concentrate. It's
Yeah.
it's really
100%.
difficult, isn't it?
Yeah.
Oh, yes. Before we go on to the next bit, shall we do some questions? I've just seen quite a few come
Yeah,
in.
perfect.
Is that all
Yeah,
right?
please. Yeah, of course.
So let me just address them. So yeah, Instagram we will show you at the end. This is recording currently. Um, So you will get a recording at the end. And then we've got, as a new vet nurse, how did the vets respond to coming to you with a plan? Did they feel concerned about you suggesting something? One of my fears is that I research something, but I don't feel like I can talk to my vets about, oh, I read up about this, and they'll be offended.
Yeah. So I guess like this sort of comes down to your clinic dynamic and
Mm.
your clinic as a whole. So I think this is challenging because I guess like f for me, nurse input is really important. And at the clinic I work with, the vets, we have anesthetists to be fair, but before that point, we sort of reached a place where we had a mutual trust between the nurses and the vets. And the surgeons, the vets, they had absolutely no input in the anesthetic. So we would, as nurses, completely make the plan. Um, I think if you have researched something and you want to make change, I think it's daunting and I know it's confronting, but I think you need to try and approach your vets. You need to sort of take that step forward for yourself because, otherwise things can stay the same and that's not, always the best. So I think you need to take the step for yourself. And if that's received poorly, then I don't think that's the clinic for you. And that may sound harsh, but I think in reality, like the work you do at a clinic is going to be the same relatively. You go from primary care or from specialist to specialist. The work's going to be relatively the same, but it's really important to find a hospital and a team that is going to support you. And I guess this is where a mentor comes in because you have these kind of conversations with a mentor. Um, I think if your vets are not willing to, give you the benefit of the doubt or, listen to you, then I think you need to find a clinic that does because they're out there. I know because I work in one. Um, I think you just need to take the step for yourself, give it a go, and then, you know, I know it's challenging and no one wants to get a new job, but I think that sounds kind of toxic if they're not willing to, listen to you and hear you out. Just because you're a nurse doesn't mean your opinion is any less than theirs.
No, I love that. Absolutely. I think we should be looking at things as like collaborative care
100%.
instead of
Yeah.
it being about this
Yeah.
whole like hierarchy.
Yeah.
And there is something in a book that I've read before. I think it's called The Courage to Be Disliked, and they were talking about the theory that we see people on this vertical
Yeah.
sort of thing
Yeah.
where someone is higher up than us, that must mean they're better than us, or we're not
Yeah.
worthy of having
Yeah.
our own opinions and thoughts. Whereas if we saw it as a horizontal,
Yeah.
maybe then, we would be more collaborative because at the end of the day, we have to set our egos to the side. And it is about the
Yeah.
patient, it's not about
It
us.
is. It's about the patient.
That's
And
why
I
we do
think
this.
nurses having direct input in their anesthetic management is for the patient because
Mm,
at the end of the day, we're the ones that are monitoring it, most likely. We're the ones administering those drugs. So I think you need to have some sort of collaboration, otherwise it's not going to work.
exactly. Yeah, it's tricky. It is a tricky one.
It's a really tricky one. I think for myself, like if I didn't feel supported, I would need to go somewhere that did support me. And
Mm,
yeah, I think that it seems black and white. I know it's not black and white, but
mm.
yeah, super challenging.
Got you. So, what would you say, Annie, has helped you the most in your career? Like, what has made you kind of change up the game and you're now this confident, vet tech, and you've got, your specialism in anesthesia and analgesia as well, and you train your students and, work at
Yeah,
this crazy, crazy hospital. Like, what would you say?
it's a really hard question. I think like a group of things have gotten me to where I am. I think definitely I've had the most supportive and incredible team around me. From, the anaesthetists that have trained me to the nurses I work with, to my manager, to my clinic. So like I think overall, like there's a lot of, it takes a village sort of thing. Um, I think having someone to talk to about my ideas around anesthesia and, what should my next steps be in the early run was really important. And that helped me gain really good confidence in my foundations. And then as I started to progress, the VTS, in all honesty, helped me a lot as well. It was a really challenging 3 years because it's very full on, but I just learned such an incredible amount of things over that time. I was studying ferociously, so I was just like, anesthesia knowledge was like pouring into my brain. Um, and then that also sort of has helped me gain some more practical skills as well. But honestly, I think just like studying it and just like living anesthesia has honestly like the more you learn, the more confident you feel because you know what you want to do next. You have ideas. So I think like honestly, just like my religious studying and just living, breathing anesthesia has helped.
No, that's awesome. Yeah, thank you for sharing that, Annie. And if there's anybody on this call that, they're absolutely dreading anesthesia, they're at the wit's end, they just don't know what to do anymore, where to start, how to go about it.
Yeah.
What what do you think is the next best thing for them to do? Is there anything they can prep for? Is there anything that they can do?
Yeah, I think anesthesia is hard because it's a really practical subject. You really need to be doing it to gain confidence. And that's really hard when you're coming from a place of, you're not confident, you're anxious, you're struggling to, be a part of any anesthetic event. So it does make it challenging. But, I would start by, starting to complete some anesthesia CE. If there's like some basic monitoring courses you can get involved in, if you could enroll in like a comprehensive anesthesia monitoring course. And I think just getting your hands, getting involved in an anesthetic event, even if that means you're not actually doing the anesthetic, you're just kind of hanging out with the person who is. You need to sort of know what's right in order to understand what is wrong. So just starting to, look at vitals, look at your monitor, how are patients reacting to certain things or when you give certain drugs. I think you just need to be actively involved in as much anesthesia as you can and then start to build up confidence. So maybe you start to do a basic anesthetic. So whether that's, a castrate or a spay, I know spays can be challenging. So, maybe that's a castrate or, it's a dental, something relaxed, well, not relaxed, but, something that's like ASA 1 to 2. And you start to do that with hopefully a senior nurse or a senior vet who's, willing to troubleshoot some things with you. So I think it's a hard place to start at, but you need to take some small steps and just start building your confidence around anesthesia, taking little bites, and then until you start to feel confident with your foundation skills, and then moving up to, something a little bit more challenging. Maybe it's a bigger dog who's having a spay, or, an old dog who's having a dental, so start to move up in little, bite-sized pieces, nothing to shred your confidence too much, but, just take it step by step. Have someone there that can support you with your choices, and just make sure that there's someone there that you can, float ideas by. And I can always be that person as well. Like, I'm more than happy if you have an anesthetic event coming up. Like, you can absolutely send me a message and we can talk through plans. We can talk through, what your next steps would be if you have, hypertension or whatever. I'm happy to be that person if you don't have that person in clinic. Because I just want everyone to love anesthesia like I do. So if I can help you get there, I will.
Oh, that's so sweet and nice of you, Annie. Thank you. It's always nice to have somebody. Oh, we just got a little heart
Yeah, cute.
focusing on the screen.
Are you
Oh,
guys even doing
I didn't know it
that?
could do that. I was like, what's this?
Yeah.
Oh, you're getting all the love. Oh, yeah. Oh, everybody's sending it now.
Chloe.
Oh, I love the energy, by the way. Like I've seen in the comments as well, like people are replying to others, and I
Oh,
think
so
it's really
nice.
nice. We will get round to questions, don't worry. We're going to do everything
Yeah.
at the end, so I'm not ignoring you. We're not ignoring you at all. But yeah, I love that what you said, and with that support there, that just that makes me feel
Yeah.
really
And
happy.
the support is the biggest thing. You need someone there
Mm.
to support you. Otherwise, you're not going to be able to thrive.
I agree. And like, of course, like things don't always go to plan, do they? We can do all these anesthetic plans, we can do all of this, but I thought this is one of the biggest worries that a lot of people come to me about. I've
Yeah.
had students come to me about, I've gone through it myself.
Yeah.
And
100%.
what happens when an animal just wakes up out of the
Yeah.
blue because we've all been there. We all know
For
where we
sure.
go, why is this woken
100%.
up? How
Yeah.
do we overcome the anxiety of this?
Yeah.
Because I feel like this is a reason why people don't feel confident, is
For
because they
sure.
go, what if this happens?
Yeah.
What would you say? What would you say
What
to
do you
that?
do?
Because
Yeah.
I
So
never have the actual answer to this because I'm like, I don't
I don't know. Yeah. So
know.
I think like we need to have a plan. Um, I talk a lot about, and I teach the nurses at my clinic, we do like a really solid anesthetic plan. And, the anesthetic plan is almost as important as the monitoring itself. We start to, how I like to do it is I break it down into little sections. So I start to look at the patient. So let's say use an example of, a puppy that's having, I don't know, a castrate. So I will put my patient at the top of my page, I don't know, Coco, that's not a boy's name, but let's go with it. Coco, 15 kilo border collie, here for castrate. He's, 12 weeks old. And then I start to look at it. So he is a pediatric patient. So I start to break it down into patient considerations. And I guess with this specific dog, I you need to look at the things to do with your patient that are going to directly affect your anesthetic. So for this dog, he's a puppy, he's a baby, so that's going to affect our anesthetic. The next step I start to break down is the complications that we're going to expect to see. So, with any anesthetic, we sort of have our core anesthetic complications that we're going to see. And we talk about it as the four H's and a B. So, you're going to have hypotension, hypercapnia, hypoventilation, hypothermia, and then the B is bradycardia. So I start to then break each of those complications down and I start to look at which ones I'm probably going to see most commonly. So for a puppy, it's probably going to be hypothermia. He's a baby, he probably doesn't have much muscle mass. It's probably going to be hypotension as well as bradycardia. And these two in puppies sort of go hand to hand. So then, now that I think about the complications, I'm then going to start to think about how I'm going to treat them. So, for our hypothermia, I guess we can't treat it so much, but we're going to try and prevent it. So, I'm then thinking about I'm going to give active warming. I'm going to use a low oxygen flow rate. Um, we're going to use heated fluids. He's going to be warmed at every stage. And I sort of break this down and it gets quite complicated and there's lots of arrows going. But then I'm breaking down all the complications and I'm talking about how I'm going to treat them even before I've anesthetized this patient. So then, we get to hypotension. I already have a really solid plan in place. I don't need to think about it at that point because I've already thought about it at a time where I'm not, as stressed or under the pump. So this is how I really started to plan my anesthetics. And especially as you get to do some more complicated things, it's really important. And I guess the anxiety around a patient waking up it sort of falls under the same thing. We need to have a plan. So what am I going to do if this patient wakes up? I'm always going to have some more induction agent, whether that's some more Alfaxan, if that's what you guys use, or propofol. I'm always going to have a syringe of that. We call it pocket probe. Whenever I'm moving anywhere with the patient, I have pocket probe in my pocket. I put it in the same pocket every time, so it's like muscle memory. If I see my dog move, the probe comes out and I'm giving a dose. When I was learning, I probably do what a lot of you do, and I just would panic and I would give a big bolus. And then I'd be like, well, shit, like now my dog's apneic for the next, 2 minutes. So now I'm hypertensive. So I sort of say to the nurses that I'm training, have a dose in your head. So for propofol, we sort of start at 0.5 to 1 milligram per kilo, and we just sort of titrate that to effect. For Alfax, we'd probably give, 0.25 to zero point 0.5 mg per kg of Alfax as a little bolus just to get our patient back to sleep. I guess if the anxiety around patients waking up is the main problem, we need to sort of break down what things we're going to be seeing if our patient is waking up. So that way we know that when we're seeing these things, our patient's getting light, I'm giving Alfax or probe straight away. So we're probably and most likely the thing I see commonly when a patient is getting light is an increase in respirate. That's going to be the first thing that you see. So if you're starting to see your patient breathe up, a patient under anesthetic is going to be breathing at, 10, 12, kind of 14, maybe at the tops breaths per minute. If you're starting to see that increase, it's likely that your patient is getting light. So at that point, if I can, I'm going to be checking my depth. I'm going to be looking at my jaw tone, at my palpebral, and if I think they're getting light, I'm just going to give them a little top up of our induction agent. That being said, I guess we also need to differentiate this from is our patient feeling pain? And I think that's probably a talk for, a whole nother day, but I think we need to be able to differentiate between our patient being light and our patient being in pain. So I think the differences you're going to see with both of these is if our patient is light, we're going to look at those physical parameters. We're going to look at our palpebral, our jaw tone. If that's present, it's most likely going to be Alfax or your patient's getting light. If your patient is not showing these responses, then it's most likely pain, and we need to give a top up of our analgesia. So, whether that's a fentanyl bolus or a methadone bolus, whatever you guys use, or even Dexmed or medetomidine is a really good option in these situations as well, especially if your patient is keeping getting light consistently. Little micro doses of medetomidine are going to be your best friend. And when I say microdose, I mean like 0.25, 0.5, 1 mic per kilo, sort of in those ranges. So if you're having this patient consistently waking up, little boluses of your alpha 2 is going to be your best friend. But I think to deal with the anxiety, I think you need to have a solid plan. You need to make sure you always have drugs on you, and that you're able to really lock down what we're seeing when our patient is getting light. So, and we need to differentiate, when these patients are getting light. It's most likely going to be when we're moving. So we're going from, treatment into surgery. So we're expecting them to get light at that point. On incision, big one. So make sure like before incision, I always say to the new guys, have your port right here, tape it where you can see it. Have your dose of propofol in your head, have it in your hand, have flush, and then you can literally just give it as you're seeing, the respirate, the heart rate, whatever increase. So you're ready. So pocket probe will be your best friend.
I love all of those points that you made, and I've always had pocket probe as well.
Pocket
Like
probe. Yeah.
I used to have chronic anxiety with
Yeah.
like them waking up. That used to be my main one because a lot of the
Yeah.
time I was like, I don't know why this is
Shit,
happening.
I have no drugs. Like,
Yeah,
am I going to give it?
but if
Yeah.
you have it in your pocket, like you
Yeah.
said, or if you've got it on the
100%.
side and you can see it and you can grab it quickly,
Yeah.
you
Yeah.
know, you can ask your vet, you know what? animals
Yeah.
waking up, I'm sure they don't
Yeah.
mind, you
Yeah.
bunging in a little bit to affect,
Yeah.
like you said.
Yeah. 100%.
Um, yeah, so they're really good pointers, which I hope have been quite helpful for everybody. Now, of course, and this is someone's popped in the comments as well about this. But in the unfortunate circumstances, like how does one come back from an anesthesia death? I know that we've spoken about it a little bit as well
Yeah.
before the call, but what do you think is is something that can help people build that trust back in with themselves again? Because it is deeply upsetting. I've had this happen to me once before.
Yeah.
And I felt awful. I blamed myself. I
Yeah.
felt guilty thinking,
Yeah.
this person hasn't got their dog. It was around Christmas, so I thought they've not
Yeah.
got their dog for Christmas. It's all my fault.
Yeah.
How does one come back from this
Yeah.
sort of thing? Because it is monumental, isn't it? The grief that we
100%.
feel.
Yeah. I think like an anesthetic death is going to sit with you forever. It's something you're always going to remember. I think like this is where a really good team, a good and supportive team comes in. I think it's really important that you have a good debrief. You need to talk about the instances in which this anesthetic death arose. And sometimes anesthetic deaths are they're inevitable. These patients are really sick and they have an anesthetic, and we sort of expect death in the worst way. Nothing we could have done would have changed that. And I think those ones are a little bit easier. Maybe easier is not the right word, but it's not from a direct action of myself. I think we need to really acknowledge how we're feeling. We need to talk about it. And we're obviously going to be feeling grief around this, around this event. And that's okay. And I think like we just need to take it slowly. For me, when I've been in these situations, I need to make action. So, in order to make myself feel better, and I've definitely been in those situations, I need to make action to make sure I know that this is not going to happen again. And that sort of helps me build back my confidence. So, whether you make changes to the way you are performing anesthesia, so I have an example of myself. So this didn't lead to a death, but it definitely could have. There's been two situations that didn't lead to a death, but I picked them up soon. So I had a dog that I was on a propofol Tiva, and it was a really stupid mistake on my end. I did the math for my TIVA and I didn't divide it by 10 because in my head I'm like, I don't need to divide it by 10 because I know what it is. But instead of putting the correct number in, I put the number in without dividing it by 10. So I was definitely overdosing this dog on a lot of propofol and I picked it up. So then in my head, I need to make sure that this never happens again. So now I follow the math through, even if I'm dividing it by a stupid number like 1 or 2 or 10. I need to make sure I follow the math through. So another example was I nearly injected some drugs into an arterial line, which probably wouldn't have killed the dog, but it would have been very bad for his little leg again, and I hadn't labeled it. So now I always label my arterial lines. I make it really clear. So for me, I need to know that if a mistake has happened, I need to know that it's not going to happen again. And I guess this is where like anesthetic checklists come in, make sure we are getting our drugs double checked by multiple people, making sure you're only drawing up drugs that you are going to be using. If you're drawing up something like bupivacaine that will be cardiotoxic if it's given IV, you make sure, that never has a needle on. You put a bung on. So, just making little steps to help, um, make sure that that event never happens again. And for me, I think mistakes are a really important part of learning. You need to make mistakes to learn from them. It's sucky when that mistake has led to a death, But I think for me, I would need to know that that mistake wasn't for nothing. You need to make sure that you have learnt from that experience and are able to grow from it, I suppose. I guess in terms of like a mental, mentally moving on, I think it's just going to be about time, having the right support, making sure that you are talking about it, if you need to speak to someone, then you should. I think you need to seek the right steps in that scenario to help, mentally recover from that sort of situation because it will definitely stays with you. And that's okay. You don't need to forget about it. It's important, that you don't forget about it. It's just about, taking the correct steps to, learning from it, moving on from it, and not letting it, completely wreck your confidence altogether. Because, everyone makes mistakes, but it's how you grow from that mistake that is what shows yourself and your character the most, I think.
Mm. That's really helpful. Thank you, Annie. Yeah, because we might have not all on this call experienced our own
Mm,
anesthesia death, but when it
yeah,
does happen, it is absolutely horrendous.
yeah,
And like you said, it's hard to deal with it, but
yeah,
you have to learn from your mistakes
yeah,
because,
100%.
you know,
Yeah,
you probably won't make that mistake again,
yeah,
because your brain's now learnt that that is an absolute painful
100%.
mistake to
Yeah,
make.
yeah,
So it's very unlikely you'll do that again.
yeah,
But it is difficult, and I do feel everybody who has gone through that because it does suck quite
yeah,
massively.
for
Now,
sure.
is there any other advice you would like to give to anyone listening about, anything anesthesia related before we go on to some questions, Annie?
Yeah, I think like I've said before that, anesthesia is such a practical skill. So I think just getting involved with anything you can anesthesia related, whatever it is, big or small, is going to help push you in the right direction for your confidence. Um, I I guess like I train a lot of tech interns and one of them is actually in here at the moment. So I'm gonna call her out. And I did ask her a question before I came on here. I sort of said because, she's doing she's doing really good. She's breaking barriers. But she definitely does have some anesthesia anxiety. And I really like to push her out of her confidence or like out of her comfort level. And sometimes, I look up at her and I give her this case and she has like complete fear in her eyes. And then I go and talk to her at the end of the case and she's glowing, she's smiling, she's dancing. This actually happened, last week. The change from the start to the end is incredible. And I think just getting out of your comfort zone and doing it is a really important part of learning. And yes, you're probably scared shitless, but it's so important that you give it a go because you're going to feel so good afterwards. You'll be like, yes, I've conquered my fear. So, make sure you don't let your anxiety beat you because your anxiety can be your strength. Vigilance and is a really important part of anesthesia. So like trying to merge your anxiety into vigilance can be one of your greatest strengths in an anesthetic case. So don't not do it just because you're scared. Definitely give it a go and you'll feel all the better for it.
Oh, I love that as well. And I think it's important to reflect as well on it as well, because
Yeah,
when you've done something that you didn't feel like you could do, and you've pushed yourself to do it, you've come out
yeah,
of that comfort zone, like you'll feel so good afterwards. But I think reflecting on it afterwards, whether you tell a friend, tell a family
yeah,
member, tell a colleague, write it in your journal, whatever it is,
yeah,
I think it's also good to do that as a reminder because you've got to build that evidence in your
yeah,
brain that I can do this.
100%.
Like I
Yeah, yes, you
absolutely
can.
can throw
Yeah,
myself in this
yeah,
and it will be okay. It will
yeah,
work out. And anesthesia, it always is going to be different. All our
yeah,
patients are different, so it always will
yeah,
be different to some degree,
yeah,
won't it?
for sure.
But
Yeah,
it's having that, that inner knowing and that trusting yourself that, what, I am going to give this a go,
Yeah.
regardless of what's
Yeah.
going to happen. We've spoken about the plans now, we've gone through all
Yeah.
those different plans, the what
Yeah.
ifs,
Hmm.
and yeah, hopefully that will help with
Hopefully.
confidence. Um, so what we'll do is we'll open up the floor to questions. You can pop them in the chat box if you like, or if you want to actually speak, you may do just put like use a little hand raise icon. And I'll try and find you. Because I've got quite a few of you on. Um, but yeah, I think we had, let me see if there's any other questions. I know that we've had quite a few. It's been like buzzing this chat box the whole time, Annie, that you've been talking. So apologies if any have got lost in the ether. Let me just have a
If we've
look.
missed your question, just put it back in or raise your hand or whatever. I'll make
Yeah,
sure
let
we
me
get
have a
that.
look. I'm gonna go from top to bottom, I think, because my
Yeah,
brain's
fine.
like, what are
Yeah,
we
that's so
doing?
fine.
Um, Chelsea asked if you do any kind of anesthesia online courses.
I
How flattering.
I don't currently. I on my Instagram I do have a lot of like just little bites of anesthesia, I guess, learning. I definitely want to in the future. That's where I'm heading. So not right now, but hopefully in the near future.
Amazing. And where can we find you for these bite-sized bits of info?
Yeah, so my anesthesia is called the Unconscious Club. So the handle is underscore the Unconscious Club. I, post little random anesthesia bits, whatever comes to my mind. I also sort of post about my day and our day if I've had any cases or I see a weird ECG or a capnograph. I usually post that mostly on my stories. So yeah, usually if you have anything that you want specifically, like if there's an area you're struggling with, then please just, send me send me a message and I will make sure I make a post on it. Or if you have a question, just, yeah, send me a message and I'll answer. I'm not the best replier, but I will definitely get to you at some point. But yeah, just send me whatever you need. I'm more than happy to help.
Oh, bless you. Thank you. That's so nice. Again, I'm just having a little filter through all
Mhm.
the lovely messages, and it's nice to see that others are going, oh yeah, we've got a cheat sheet for this, and I'll
Yeah,
send you a picture. Um, that's Talita, bless her, one of my members on the club.
that's so
Thank
nice.
you. Oh, representing us really well. Um, any good resources for ECO2, so capnography,
Yep.
as this is what I struggle to troubleshoot the most, Chloe asked.
Yep. I do have a little capnograph troubleshooting, like waveform kind of thing on my Instagram, but there's a lot of really good resources just online. Even Alfaxan have a really good capnography cheat sheet, like what each waveform represents and how to troubleshoot it. So Alfax have a good one. Um, I guess just getting to know what your normal capnograph looks like day to day will be great. I know you sometimes, will see a capnograph and you're like, what is causing that? So yeah, Alphax have a really good one actually. So have a look, have a look. I think they still have it online, but otherwise just Google. In On my Instagram, I have a few really good textbooks sort of pinned at the top. Um, so a few of those have good capnography references as well.
Amazing. I love that. Thank you. I'm just seeing if there's any more sort of questions that I might have missed. Da, da, da. It's always difficult to read on these, You're like, oh, trying to
Let
read
me
through
see.
it
Yeah,
all.
I get. Oh, here. I haven't been looking at the chat, so I can see.
I think we
Um,
had one that says, I think this is in relation to animals waking up randomly.
yep,
Because you mentioned about respiration rate increasing.
yep,
So
yep.
this person has put, if only respirate increasing without any other signs of getting light, You mentioned giving microdoses of Dexdom as needed. Should this
Yep.
always be alongside adding extra pain relief if we assume this is happening because of pain?
Yeah. So I guess Dexmed is a good one because it does have a little bit of analgesia in there as well. But I guess with the microdoses, the analgesia will only last as long as the sedation. So, yes, I think my first protocol, if we think our patient is painful, we should give a bolus of our analgesia. So, if they're on a CRI, maybe like a fentanyl CRI, we'd give like 1 to 2 mics per kilo. If you're giving boluses of methadone, I probably would give like 0.05 to zero point 0.1 milligrams per kilo of methadone or, ketamine or, whatever you use. But yeah, I think if we think it's pain, we should treat it as such. Just having a look through some questions. Have a look to see what we've missed.
Awesome stuff.
Um, do you
Can't
ensure, this is from Kate, sorry, I just have
Oh,
seen it.
that's okay.
Do you ensure there is always a nurse to monitor anesthesia and another to clip sorts instruments? Is it something I'm trying to make as a protocol at my clinic? Yeah, a really good point. So when I first started at the clinic I worked at, and this probably added to my anxiety, was the fact that we would monitor an anesthetic and we would clip and prep and we would open all the gear. That is not how we run things now. We have a dedicated anesthesia nurse. So the anesthesia nurse will follow the case from start to finish, as long as there's no lunch breaks needed. So they will, pre-med the dog. They will TPR it, pre-med it, induce it, and they follow that anesthetic through right until the recovery. And then we're lucky at my clinic. Once we recover, we sort of hand over to the ICU nurses, and then they take the recovery from there. But yeah, I think this is a really important point, and this makes anesthesia, less stressful, and it's also much safer for the patient because obviously you have eyes on the anesthetic. So yeah, I think Kate, it's definitely a really great protocol to try and start up. The only thing it does make it challenging is staffing. You need a lot of nurses to do this, especially, from if you have a busy workload. So where I work, we have 12 surgery nurses, just surgery nurses. And even sometimes that's not enough. So you do need quite a lot of nurses to make this work well.
Absolutely, I agree. We'll
Yeah.
do one more question then. And what I'll do whilst you're answering, Annie, I'm just going to put up your socials on here.
Yeah.
Can everyone see that all right?
It looks good for me.
Yeah, nice one. So if people want to scan, they can go straight to your profile. I thought that'd be easier.
Oh,
Or is
great.
that
That's very organized of
underscore
you.
thing? Yeah, that's okay. So the last question we had, let me just go back onto it. My screen's gone all funny. There we go. Belle asks, how do you get over fearing something crashing or the fear
Yeah.
that you don't know what to do if one does crash? What would
Yeah.
you say?
This is a good question. And one we didn't cover actually. But so I guess there's two parts to this. So I don't even, how many cases would I have anesthetized? I don't even know. A lot. And over my time, I have only dealt with two actual crashing patients under anesthesia. It is quite rare. Um, these were mostly sick patients or ones that were, bleeding out because of masses. So I don't see it too commonly. Obviously, it does happen, but an anesthetic death is rare. Um, One thing that is really helpful is the Recover course. The Recover course online is a really great course, and you can just do like the theory side of things. But I would really recommend it. It's not too expensive. I think it's like, I don't know how many pounds it would be, but it's like $60 to complete. And basically what the Recover course does is it breaks down exactly what you need to do. It breaks down, what's happening in CPR, what drugs you need to give. it's a really good course. So if you're stressed about, a crashing patient under anesthesia, I would really recommend doing your Recover certification. Even if you don't do the practical side, the theory course is a really great course, and it's worldwide, so they've gotten all the information down to a T. It doesn't take too long, a couple hours maybe, and I definitely felt much more confident after doing that course with, crashing or CPR sort of situation. So definitely give that a go if you're stressed around that.
Amazing. I love that. Thank you, Annie, for answering that question.
It's
That was
fun.
beautiful. So before everybody goes, Annie, again, thank you so much
Oh,
for
it's so
this.
fun.
I
I hope it's been
appreciate it with all my
helpful.
heart, and I'm sure everybody on the call has got at least something out of today that has
Hope so.
given them that little bit of hope that they can do it, that they can overcome this, anxiety towards
Yeah,
anesthesia.
100%.
Um, so if anybody wants to keep up like the momentum of this like supportive community and like all the amazing things that we're doing, just want to briefly speak about the Positive Vet Nurse Club. So we do bi-weekly live group coaching calls. This one is actually included on there, but I wanted to let more people join to see what they think. So again, it's that safe, supportive community. All vet nurses, we've all been through something in our careers, and this is, to help build confidence, mindset, all that sort of stuff. We've got lots of resources, we've got journal prompts, we've got videos, all different tools to help you build your confidence in practice. Um, so it is very, very special. And there's also a coach in your pocket where you get to get coached by me in there, which again, for the value of how much it costs, so it's £10 a month. You can get it off your CPD budget. There's no massive commitment. You can cancel any time that you want. Um, but it's a really good little community membership to be a part of if anyone was interested. All the details are on there, if that's something that you're all interested in. So I'll stop sharing for a second. Yeah, so I hope that this has been amazing. So I've gone over ever so slightly, but I feel like this was such a wonderful call. And again, Annie, it's been amazing having you.
For having
So
me.
thank you
It's been
so
great.
much.
No, so fine. So if anyone has any questions or wants to talk anything specific anesthesia related, just send me a message on Instagram. I'd love to chat to you all. So yeah, just sling you a message. Yeah, I'd love to hear from you.
No,
Thank you so
thank
much for
you.
having
And I'm
me. I love
sure
it.
I'm sure you're going to get plenty of follows from
That's
this.
so nice.
And people sending you messages, and you never know, it could lead to something for you in the future, Annie.
Yeah, I love
You
that.
know about these little courses that
And
have been coming up in the
yeah, I
chat,
would love to. That's you've listed my goal right there.
Yeah, you know what? Like just the way that you've explained everything, I think one of the girls said that, you've explained things really lovely, and this is what I wanted it to be about this call,
Yeah,
is to have that real, this is happening. Because you can
for
go on
sure.
like other anesthesia courses and yeah, they can
Yeah.
teach you about,
Mhm.
the knowledge side of things, but
Yeah.
we were more looking today about the mindset around it all,
Yeah.
weren't we? And,
Yeah.
trying to I've not seen that anywhere else.
Yeah,
Like,
no,
correct
it's
me if
really
I'm
great.
wrong, but I
Had
feel
so many
like
people messaging me about it. So really, yeah, really, really great. Really
yeah,
great
so
initiative.
it's super important. And again, I can't thank you enough for
No, it's
coming
so
on
fun.
and
Thank
joining
you.
us on the call. So yeah,
Great.
we've had all the thank you messages coming through.
I can see.
No,
Thank
you
you.
aren't alone, Chloe. Like we're all in this together. We'll all help each other because that's what we should be doing in this profession, really, not bringing each other down. We should be looking at ways to support each other and be there for one another, I guess, right?
For sure. No, really, really great. Really, really great.
All right. Annie, I'll speak to you after this as well.
Yeah,
But
perfect.
yeah, thank you everybody for for being on. And if you need to head away, you may. But I'm gonna stop the recording. But yeah, again, thank you everybody. If you're in the UK, I know it's been an early start, and then wherever you are in the world, again, thank you so much. Um, Take care, everybody.
Thanks, everyone.